Cats are very interesting. Cats are a greatly misunderstood species. They are more intelligent and more emotional than most people other than devoted cat lovers know or understand. Cats can't smile much. They have a very limited platysmus muscle. We have an extensive platysmus muscle beneath our chin and over our cheeks, along with the muscles of our forehead and our eyelids, allows us to make a multitude of expressions. Cats don't have much platysmus muscle. Cats can't smile. But they are, as I said, quite emotional animals. They will rub their head against a person they prefer. It's not just a show of affection. They have glands between their ear and their eye. They are marking that person as their property. They are claiming him. Veterinary clinics often have pets. And the dog on the cover, the Cavalier King Charles, was our clinic pet. These are often animals that are brought in with serious problems that require extensive care, expensive long-term therapy, or special surgery that is quite expensive, and the people either can't provide it, aren't willing to provide the effort that it takes, or can't afford to do it. I have had many cases of people telling me that their cat urinated in their white bathtub in order to demonstrate to them there was blood in the urine when they had a urinary tract infection. Clarence the clinic cat. Male cats can get an obstructive bladder. This occurs because of the dry diet, the unnatural dry diet, and largely grain-based with high mineral content feeds that we feed them. It causes a concentration of urine and precipitation of minerals. The most common are called struvite crystals, which are sand-like particles, magnesium ammonium citrate. The male cat gets his urethra obstructed and his bladder filled because they have a much smaller urethra than the female. Clarence was brought into the clinic because he had an obstructed bladder. Clarence was a beautiful, long-haired white cat. He had gorgeous eyes. Normally the treatment for the obstruction of feline urolithiasis is to pass a catheter and flush out the sand-like granules or propel them back into the bladder and clear the urethra so the catheter can be put in and the animals put on fluids and alter the pH in the diet to alleviate the condition and to prevent recurrence. This we were unable to do with Clarence. When told that it would require an extensive surgery and would cost quite a bit of money, the owner did not wish to pay for it, and so he wanted us to put the animal to sleep. Instead of putting the animal to sleep, we assumed ownership with the owner's permission. We attempted to do the surgery up the penile urethra, and we were unable to do so. So I had to open the abdomen of the cat and open the bladder, and it was a large mulberry-shaped stone in his prostate, firmly embedded. It wasn't a struvite crystal. When we closed the bladder, it was quite obvious that the urethra was too traumatized to be utilized and function in the normal way. So we transitioned it to the front of the pelvis, a prepubertal location. In other words, he urinated between his legs. He made a complete recovery and lived with us for many years. There was a small bakery a few blocks away from our clinic, Donut Island. We used to like to go there and get a bag of donuts for our morning coffee break at the clinic. Often we would be accompanied by Clarence. We had a bachelor farmer that used to frequent the clinic, Bob Tice. He was a good friend and a valuable ally. With some experience and training, he was very good to assist at surgery and after hours he would accompany me when we had to do an emergency cesarean on a cow or sew up a wire-cut horse, something like that. Like many bachelor farmers, he loved animals, but he was a bit mischievous. He took to feeding Clarence small bits of donuts. Finally, one morning, we came into the clinic for our coffee break. We found Clarence up on the counter, almost completely in a bag of donuts, merrily crunching away. I think if Clarence ever ran away, he could be found at the door of Donut Island, waiting for them to open up.